And that means, in this case, fierce compassion means that you're not afraid of the pain that might come up with the person when they're facing the truth. And I don't mean that in a confrontational sense. But the fact is, the reason that all of us have problems is because we haven't looked at and dealt with the pain that we carry. So if I'm going to be a clear mirror, and if you look into that mirror that I'm holding up for you, you're going to see your pain.
In a world where understanding often feels out of reach, Dr. Gabor Maté opens the door to a revolutionary approach. Join us on a journey of compassionate inquiry, where curiosity becomes the key to unlocking profound healing and transformation. This video is about to teach the compassionate inquiry approach developed by Dr. Gabor Maté, so that individuals can connect to the truth within themselves in the present moment, become free from self-generated suffering, and gain insight, clarity, and choice in their behavior, to bring compassion, respect, acceptance, insight, healing, freedom, and connection to humanity through an international community of skillful, compassionate inquiry practitioners.
As a family physician, I was dealing with people with physical illnesses, whether it be neurological conditions like multiple sclerosis, or autoimmune diseases like Crohn's disease or colitis, or chronic fatigue or irritable bowel syndrome, or cancer, chronic asthma, or on the other hand, mental health conditions like depression, anxiety, addictions, or childhood developmental issues like ADHD. And after some years of practice, it was impressed upon me just by my observation that none of these issues, whether physical health or mental health, could be separated from people's life experience, and most often their childhood experience, and the emotional patterns that they developed all their lives. And as that realization of the unity of mind and body, and the inseparability of people's life experience from their health conditions dawned upon me, it became obvious that to help people, it wasn't enough just to help with the physical side of things. So if somebody is depressed, it's not enough to give them an antidepressant. If somebody's got rheumatoid arthritis, it's not enough just to give them an anti-inflammatory or something to suppress the autoimmune process. You actually have to deal with their emotional lives, which means spending time and talking with people. Now, ideally, I would have had people to refer to. So ideally, I could have sent people to psychotherapists or to psychiatrists to deal with those issues. Because nothing in medical school trains you for that. Problem is, on the east side of Vancouver where I worked, people couldn't afford psychotherapists, for the most part. And the psychiatrists are not trained to do this kind of work at all. They're mostly trained to make diagnoses of illnesses and to treat them with medications. But they really don't much learn how to talk with people, and especially how to listen to people, with some exceptions. But I'm talking by and large. Therefore, by default, I began to spend time listening to my patients myself, and at the end of each day I would slot a couple of half an hour or hour-long sessions just for people to come in and talk. And so through that process of listening to my patients and talking with them and doing some very inept therapy in the beginning, but inept only in the technical sense, the fact that I was listening and interested in people already made a big difference for them. And then in the process of doing my own therapy, having to deal with all the issues that were besetting me in my 40s and beyond, so my own personal growth, and then for my various books on mind-body health and stress and addiction and ADHD and other issues, I had to do a lot of research. I had to absorb and become familiar with a lot of information. So all that personal work and professional work and research led me then to develop a certain way of looking at things, and from that way of looking at things, arose this method of asking the right question at the right time, and that's what I ended up calling compassionate inquiry. In response to a request, after people had watched me work at workshops or in therapy with people, they would say, well, could you teach us your method? And I would say, I don't have a method to teach, I just do what I do. Until people kept saying, yeah, I know there's something here that you could teach. And I still wasn't sure whether I had anything to teach or whether it was just something that I knew intuitively how to do. Until somebody actually kind of painted me into a corner and said, okay, you got to do this. And I said, okay. And so they set up this 2-day session in Toronto, which I was initially hoping that, I was literally hoping that nobody would sign up, because then I wouldn't have to expose my ignorance. But 350 people did sign up, with another 100 on the waiting list, therapists and healthcare workers mostly. And so we did it, and it was very successful. And I realized since then that there is something to teach here. There's a method here that people will apply it in their own way, according to their own lights, according to their own gifts. And they may have approaches or gifts that are different from mine. But there's something also very objective there that can be taught. And that's what I've come to call compassionate inquiry.
And what do you feel are the therapeutic or healing benefits of just being present with other people? I mean, you've seen it in your work.
Yeah.
So you can really speak to it.
Dr. Gabor teaches workshops where he models the process of compassionate inquiry with course participants, which serves to instruct therapists in the practice of this powerful technique to help clients access deep healing and transformation. In the compassionate inquiry training, you will learn how to cultivate presence, being with what is, to bring attention to body signals in clients and yourself, to enhance your perception of what is not being revealed overtly, to enable clients to access emotional states through body awareness, how to create and maintain a safe, sacred space between client and therapist, how to facilitate the expression of what has remained unexpressed, how to keep a client engaged in present moment experience, the importance of patience, respect, and choice in the therapeutic process, how to uncover early traumatic events of childhood and unconscious feeling states through compassionate inquiry.
The biggest aspect, or the most important aspect of the healing process by far, is the degree of safety that the individual experiences with you. And safety is not a question of whether you're threatening them or not. Safety is actually how well connected they feel with you. Because an infant, if you take an infant, and we're all wounded in infancy, and so many of the problems we deal with go back to very early in life. So for an infant, safety is not a question of the absence of threat. Because in the average home, there's no threat in the sense of saber-toothed tigers or enemies. But the lack of a threat doesn't make an infant feel safe. For the infant to feel safe, he or she has to be held by the parent. Held not just physically, but emotionally. And it's in that safety that healthy development takes place. It's because of that lack of safety, that lack of being held emotionally, that underlies the source of all trauma and virtually all pathology, as far as I'm concerned. Not all pathology, but virtually all. That also means that for that healing developmental force to be encouraged and invited and activated inside the person, they need to be held, they need to feel very safe. So when I talk about safety, I'm talking about the connection.
When I listen to you talk about safety, I think of, it sounds very close to how I would define love. What's love got to do with all this?
Well, I don't have to have loving feelings towards the person. I may or may not, but we're not talking about love on the feeling level. Thich Nhat Hanh, the Buddhist teacher, says that to love somebody, you have to understand them. So in this case, love shows up as a unconditional determination to understand that person, so they can understand themselves. And so that means not only do you not judge them, but you also don't allow them to get away with judging themselves. When I say don't let them get away with it, I don't mean that you punish them or you attack them for it, but you point out when they're not being compassionate towards themselves. So it's love in a sense of holding somebody and understanding them, regardless of whether you have an emotion of love or not. That's secondary. The primary is the commitment to holding the space for them unconditionally, and being determined, committed to understanding them, or mirroring them in such a way that they can understand themselves. So much of it is about mirroring of what's actually, what am I seeing? And then the person can decide for themselves whether they recognize themselves in that mirror or not.
And does mirror involve reflecting back the kind of language that people are using so that people become aware of maybe how we use language?
That's an essential part of what I do, is that I reflect to people the kind of language they use. I'm trying to think if I can think of an example.
Dr. Gabor Maté's compassionate inquiry is an introspective method for self-discovery and healing, particularly from emotional trauma. Here's a breakdown of its core aspects. Self-compassionate questioning. It involves asking yourself gentle, curious questions to understand your emotions and underlying needs. It's about replacing judgment with kindness. Body awareness. Compassionate inquiry acknowledges the connection between emotions and physical sensations. By tuning into your body, you can gain valuable clues about your emotional state. Exploration of needs. Traumatic experiences often stem from unmet needs in childhood. By understanding these needs, you can develop more self-compassion and healthier coping mechanisms. Inner child work. Compassionate inquiry encourages connecting with your inner child, the part of you that holds on to past hurts. By offering yourself the comfort and understanding you may not have received as a child, you can begin to heal. Moving beyond the story, we often create narratives around our experiences. Inquiry helps you see past these stories and access the deeper truths about yourself and your emotions. Compassionate inquiry is not a quick fix, but a practice that fosters self-understanding and promotes healing from the inside out. For his groundbreaking medical work and writing, he has been awarded the Order of Canada, his country's highest civilian distinction, and the Civic Merit Award from his hometown, Vancouver. His books include In the Realm of Hungry Ghosts, Close Encounters with Addiction, When the Body Says No, The Cost of Hidden Stress, Scattered Minds, The Origins and Healing of Attention Deficit Disorder, and, with Gordon Neufeld, Hold On to Your Kids, Why Parents Need to Matter More Than Peers.
Interpret what people say in a way that can help, is insightful in that way.
Well, it helps that I used to be an English teacher, so I really like language and the meaning of, but as a method, it's not that difficult, because as soon as somebody uses a metaphor, and they'll tell you everything about the meaning. So that thing about the earth and the sun doesn't take a lot of deep thought to figure out. You just, okay, this is a metaphor. What's the metaphor about? And then right away you get the actual meaning of what they're saying to you. So that's a skill you can develop, just rather than just letting it go. Because, of course, on a conscious level, what the woman was saying is that my mother, that's what she was saying consciously. But it's the unconscious meaning that really you have to reflect to people. And in this case, all you have to do is look at the metaphor. So if you just have an ear, when somebody's using a metaphor, look, and that's going to tell you what's really going on in their minds.
Mm-hmm. The literal meaning.
The actual meaning, yeah.
So if I can think about all you said so far, being present with people, really listening and paying attention to cues, mirroring and reflecting back what people are saying, are there, tell us about the compassion.
Well, so compassion exists on a number of different levels, but the essence of it is that you really are there to support the healing of that person, support the process of that person becoming whole, or recognizing their wholeness, which is what healing actually means. And so that means no judgment. I mean, I was talking to somebody yesterday whose therapist is forever telling her, well, if you're going to be that way, I'm not going to see you. And he will actually explode sometimes in very angry tones. Well, he's got an issue. The issue is not with the client, the issue is with himself. Because if he gets triggered, he could compassionately ask himself, okay, what is being triggered in me? Or he can be compassionately asking, why would that person say that or behave that way? But to move to judgment and move to aggression is not compassionate. So compassion simply means a willingness to accept the other person exactly as they are, and with a view to promoting their healing. Now I can give you a more nuanced 5-level definition of compassion.
Gabor Maté proposes 5 deepening levels of compassion that move us from feeling sorry for someone to truly seeing their potential. 1. Ordinary compassion. This is the most basic level, where you simply feel bad that someone is suffering and wish they weren't. It's a feeling of empathy and concern. 2. Compassion of understanding. Here you go beyond just feeling bad and actively try to understand why the person is suffering. You want to know the root cause of their pain. 3. Compassion of recognition. This level involves recognizing a shared humanity. You see yourself in the other person's suffering, realizing that you're not fundamentally different and could be in their shoes. 4. Compassion of truth. This compassionate state involves being honest and not shying away from difficult truths, even if they cause temporary pain. You believe the truth can be liberating in the long run. 5. Compassion of possibility. This deepest level involves seeing the potential for wholeness and healing in the other person. You believe in their capacity to overcome their struggles and thrive. By cultivating these deeper levels of compassion, we can move beyond simply feeling sorry for others and actively support their journey towards well-being.
To be more himself. Then when his body was functioning totally well. And he called that fierce grace, where something happens that may occasion pain at the moment, but actually promotes your healing and your wholeness and your development. So fierce compassion means you're not there to make them feel better. You're there to You're there not to make them feel better, but to make them better at feeling. And that means dealing with whatever's there. And that means, in this case, fierce compassion means that you're not afraid of the pain that might come up for the person when they're facing the truth. And I don't mean that in a confrontational sense. But the fact is, the reason that all of us have problems is because we haven't looked at and dealt with the pain that we carry. So if I'm going to be a clear mirror, and if you look into that mirror that I'm holding up for you, you're going to see your pain. You're going to feel your pain. Well, I have to be okay with you feeling pain. I can't be there to protect you from pain. I'm not there so that when you leave my office or the session with me, you feel better. If you do, that's great. And I think there's something about the truth that actually does make me feel better, people feel better. But that's a secondary outcome. The primary outcome is that people are helped to recognize the truth about themselves, which gives them much more freedom in their lives.
And to what extent do you have to be comfortable or good at facing or witnessing your own pain to be able to be in the presence of someone else facing their own pain?
Well, see, that's the whole problem with a lot of medicine and a lot of psychiatry and a lot of therapy as well, is that the practitioners haven't dealt with their own pain yet. Therefore, they get very uncomfortable with the pain of others and they want to manage the other person's pain rather than to allow the truth of that pain to guide the person's path. So it's all about symptom control and making people feel better. Now, that comes from a good intention, but it's not a helpful one. And I really do think that, so when people come to these seminars, very often they come believing to learn a method or to learn about trauma or learn about some didactic matter, but really what I did is I learned a lot about myself. And then I'm told that because of that I'm so much more able to be, and that the work has become much more effective, as much because of what I've learned about myself as because of the method that you taught.
So the method is really helping people to do the work that they need to do so that they can be present with other people and be with them as they do their
Yeah, and the inquiry is to see what is exactly that's it. You know, when I look at my unsuccessful interactions with people, when I was wanting to be a helper, there was something in me that was in the way.
What do you mean there was something?
In the serene setting of a mountain retreat, Dr. Gabor Maté led a group of eager participants on a journey of self-discovery through compassionate inquiry. Among them was Elena, a woman burdened by a lifetime of self-criticism and a relentless inner voice that chipped away at her self-esteem. During a group exercise, Elena shared a story about a recent work presentation that went poorly. Shame painted her cheeks as she recounted her fumbled words and the pitying glances from colleagues. The room fell silent, a space held for her vulnerability. Dr. Gabor, with his gentle demeanor, invited Elena to explore the situation further. Elena, he began, as you shared your story, I noticed a flicker of sadness in your eyes. Can you tell us more about that feeling? Level 1, compassion. Elena, surprised by the shift in focus, paused. It's just disappointment, she mumbled. I should have done better. Dr. Gabor continued. Disappointment often stems from unmet expectations. Can you explore what expectations you might have had for yourself during the presentation? Level 2, compassion. Elena pondered for a moment. I guess I expected myself to be flawless, to impress everyone, she admitted. Dr. Gabor's voice softened further. And what if there's another way to see this, Elena? What if that inner voice, pushing for perfection, isn't serving you? Perhaps there's a younger part of you, maybe a little girl, who feels scared of making mistakes. Level 3, compassion. A tear rolled down Elena's cheek. A memory surfaced, a childhood incident where she was harshly criticized for a misstep. The harsh words echoed in her mind, fueling her relentless self-criticism. There you are, Elena, Dr. Gabor said, gently, acknowledging the pain he saw reflected in her eyes. Level 4, compassion. This inner critic might be trying to protect you from that same kind of hurt. A long silence filled the room. Then, with a shaky voice, Elena spoke. Maybe it's time I stopped listening to that voice. Maybe it's time I forgave that little girl for wanting to be perfect. Level 5, compassion. A wave of understanding washed over Elena. The room erupted in supportive applause. In that moment, through compassionate inquiry, Elena began to see the root of her self-criticism. She glimpsed the possibility of self-compassion, of treating herself with the same kindness she would offer a friend. This was just the beginning of Elena's journey, but with the tools of compassionate inquiry, she embarked on a path of healing, one gentle question and self-discovery at a time.
It's that there's a reason for everything, and that every human behavior, every human thought, every human emotion, every human reaction, doesn't matter what it looks like on the outside, reflects a desire to be loved or to love. And as Marshall Rosenberg, who teaches nonviolent communication, said, very often we make these communications, what he calls so that it doesn't matter how people behave or speak, there's some basic human need. That human need was at some point frustrated in early development, and that person has been all their lives trying to have that need met. Doesn't matter how they behaved, even if they behaved in the most aggressive and inhuman and obnoxious fashion. There's always a reason. So that means that when somebody comes for help, when somebody actually comes for help, then you have to be able to see that need and that real human being underneath the words and underneath the behavior. In other words, you have to see the person more clearly than they see themselves. And then, not so that you can deliver your opinion to them and have them accept it.
And there's more questions that I have. I wish I could keep going, but it's really been a pleasure.
Thank you.